Hi, thank you for joining us. I'm your host, Nada Youssef, and you're listening to Health Essentials podcast by Cleveland Clinic. Today, we're broadcasting from Cleveland Clinic main campus here in Cleveland, Ohio, and we're here with Dr. Jeffrey Brown. So nice to have you. Dr. Brown is a family medicine physician, as well as an assistant professor at Cleveland Clinic Lerner College of Medicine and Heritage College Osteopathic Medicine. And today, we're talking about shingles. But before we get into topic, I want to ask you some questions, kind of off topic to get to know you better.
Sure.
All right. So let's start with profession. If you weren't a physician today, what would you be?
Well, probably a teacher. I was already a software developer for 15 years before medical school. But ever since I was a little boy, I just was fascinated with medicine. I spent some time in the hospital and saw some of the other children there and realized that they were much sicker than me. And from that moment, I just knew I wanted to be a doctor.
Yeah.
But, you know, life takes you in different directions and it just didn't work out at first, but the calling never left.
Yeah.
So I already did that. But if it weren't for medicine now, I also love teaching. My father was a teacher. And a big part of being a doctor is teaching.
Right.
You know, your patients. I teach the medical students, also our staff as well. I just like to explain things that I think are interesting.
Wow, great. And how long were you in development?
About 15 years.
Wow, it's a nice transition you made. How about your best travel destination?
Well, in general, I would say my best one is always going to be the next.
Yes,
but
true.
Hawaii was just wonderful.
Did you go to Maui or where'd you go?
I went to Maui.
I went to Maui.
I was actually visiting my brother in Tokyo.
Wow.
And on the return trip, which was also fabulous, but on the return trip, you know, why not stop off in Maui? And it's the kind of place where you get off the plane and the air in the airport smells clean.
Everything.
And everyone is friendly and smiling. And
yeah,
Hawaii is
I've been to Maui. It is a beautiful place. Okay, so how about a favorite all-time concert?
Favorite all-time concert? I would say Jimmy Buffett, just because everyone's happy, or James Taylor, because we sat in the front row.
Wow.
And there's just something, it's a different experience no matter what show you're in when you're that close to the performer.
Any upcoming concerts you want to go to?
Well, I have a 7-year-old at home, so unfortunately concerts kind of go by the wayside for the next 10 years or so.
Or maybe take her to something.
Oh, sure.
Yeah.
When she picks one, I'll take her.
You'll take her. Okay, great. Well, thank you. All right. Well, let's get into discussion. I want to talk about shingles. Let's first talk very general. What are shingles?
Yes. Simplest way to think of it is a very painful rash that occurs mostly when you're 50, sometimes sooner, but 50 is kind of the turning point where people get shingles. It's painful. And it comes because you got chickenpox when you were younger.
Okay. So you have to have had chickenpox in your previous year to get shingles.
What happens is when you're a child, or adults can get chickenpox, but typically when you're a child, you get chickenpox, your body fights off the virus, but it doesn't get rid of the virus. The virus kind of goes into hiding, and the place it chooses is right outside your spinal cord, at the base of a nerve, and it just sits there quietly for years and years. We call that latency. And then at some point when you get older, about 50 or even more so at 60, the virus decides to wake up, go for a walk, and that rash starts all up again. The pain starts all up again. I almost think of it as chickenpox, the sequel.
So it's always an inactive virus that's always in your body after chickenpox.
Right.
So what are the symptoms?
Well, typically it starts with pain. People often describe the pain as burning or stabbing or aching, sometimes an itch.
Okay, so the pain is located in a certain area, or you're talking about just like chronic pain?
Yeah, certain area.
Certain area.
And that all goes back to the fact that, as I said, once your body fights off the initial chickenpox infection and the virus goes into hiding, it picks a nerve or two. And that's what makes the whole episode of shingles, the pain and the rash, tend to be in a location. Because the virus starts out in a nerve, and when it wakes up, it walks down that nerve. And the nerve goes in a very specific area, classically around your midsection or your lower back, from the back to the front.
Okay.
And that's why you see a classic line, because that's where the nerve goes. Where the nerve goes is where the virus goes.
Right, right. So there's certain locations that shingles pops up? Because I my family member got it on his neck.
Yeah.
And he's not 50, by the way. But so it comes also on your neck, is that right? On your head, I heard it can also pop you. Why is it only those certain locations? Is there a reason?
Well, it can be anywhere.
Okay.
But again, because of the virus wanting to stick in a nerve and the distribution of a nerve, if it happens to go into hiding in the neck, when it wakes up, it goes down the neck. If it happens to go into hiding in the lower back, it wakes up and goes around the lower back.
Okay.
Now, why lower back and midsection? We don't know. But it does tend to go those two places first. And then head and neck can be another common location. But anywhere a nerve travels, you can get it on the arm, you can get it on the leg. It will go.
So before the rash appears, are the symptoms just pain?
Right. But this again is something where shingles can be very variable. About 75% of people will get the pain first.
Okay.
You still have some people where the rash and the pain come together.
I see.
You have some people where first you get the rash and then you get the pain.
Okay.
But the most common general presentation is pain for about 2 to 3 days in a specific area, which can cause confusion. Because let's say that area is right over where your gallbladder is. People think, oh my gosh, I'm having a gallbladder attack.
Right.
But it's not, it's shingles. And then 3 days later, up comes the rash.
So it takes about 3 days when you have the pain for the rash to appear?
Typically, yes.
Okay. And what does the rash look like? Is it just like a normal rash, kind of bumpy? Is it blistery? Is it, what does it look like? Disgusting?
Well, it starts out bumpy, starts out as little red bumps, little red dots that are raised. And then after about, of course, 7 to 10 days, the rash moves from red raised bumps to blisters, and then the blisters scab over.
Wow. So that's every single shingles episode is going to get blistery in 7 to 10 days before it clears.
The vast majority, yes.
Okay.
So the whole point of this discussion is to talk about what to look for.
Right.
And oftentimes in medicine, there are things which, medicine, your rash doesn't read a textbook. So you will find the bizarre case that doesn't appear like that. But yes, the great majority of the time, pain first, 2 to 3 days, then a rash for about 7 to 10 days. That rash goes from red bumps to blisters. The blisters may pop open, then the blisters scab over.
Wow. So once I have shingles once, can it come back again?
It can. About 1 to 4% of people will get it a second time.
Wow. So you get chickenpox first, right? And then you get shingles, and then you can get shingles again. So it's an inactive, it just kind of wakes up.
You still never get rid of the virus. The virus goes to sleep.
No cure for that.
No cure for that.
Right. Now, how do I know if it's shingles or just some other rash?
Right, and this is the tricky part, what I mentioned, where sometimes the rash will it'll pick a spot of the body, and you might think it's a gallbladder. You might think you're having a heart attack.
Right.
So you really can't tell if it's shingles until the rash appears. Sometimes you may just say, hey, the pain is in that location.
Right.
So maybe it's shingles, even before the rash. But it is that classic distribution. The fancy word is dermatomal pattern. So derm, skin, tome, where it goes.
Okay.
And you will see this rash in that stripe-like pattern. So in your relative who had it, it was on the neck, but it would not have been up on the forehead.
I see.
Or not likely, because that's a separate nerve, a separate dermatome. And it may go to 1 or 2 dermatomes together, but typically will not go lower back and neck.
Depending on where that vein is traveling.
Right, the nerve.
Or the nerve, I'm sorry. All right, so if I was vaccinated for chickenpox, does that clear me from having shingles as an adult?
If you were vaccinated for chickenpox, yes, because you don't get the actual virus.
Okay.
So the whole point of shingles is, it is the virus doing the work.
Yeah.
Again, like I said, chickenpox, the sequel.
Right.
Kind of like in a horror movie, You know, the monster comes along,
Right.
you kill the monster, you get rid of the monster, and then
back.
years later, he's back.
Right.
So when you get the virus, you don't actually get, when you get the vaccine, you don't actually get the chickenpox virus.
Okay.
If you were to Google, you know, you will find some extremely rare cases. Like I said before, viruses don't read textbooks.
Right.
There was one single documented case of a child who got the chickenpox vaccine and then got shingles. One case that we know of, right?
Okay.
So for the most part, if you get the vaccine, no, you're not going to get shingles.
Okay. So I know this can get a little confusing, but so I just wanted, again, to clarify. So if I don't even get chickenpox as a child,
Right.
then there is no way I'm getting shingles as an adult, correct?
Yes.
Okay.
However, and this is the big thing with shingles, and when people have shingles, you know, we say, hey, grandpa has shingles, you know, be careful, don't get around grandpa.
Right.
For one thing, it's the blister stage. When the rash turns into blisters, that's when you can transmit the virus.
So it's highly contagious when the blisters appear.
Right.
Before that, nothing? Not contagious?
Before that, not contagious. Once it scabs over, not contagious.
Okay.
So, going back to your question before, if you never had chickenpox,
Yeah.
right? Someone has shingles, the blisters form, you touch the blisters, you can then get chickenpox.
So it's spread from the fluid from the blister onto someone else.
Right.
It does not sound pretty. Okay, well, is it a life-threatening condition?
It can be. And again, this is also where we're talking about rare cases.
Right.
But yes.
But mostly not?
Mostly not.
Mostly not, okay.
But mostly can cause an awful lot of pain. And this is why we're so big on the shingles vaccine, is because you don't want to underestimate that pain.
Okay.
The pain tends to last about 3 to 5 weeks.
Wow.
Right. About 10 to 15% of people who get shingles, that pain can go on for 3 to 6 months or more.
Okay, so tell me they take something for that. For the pain?
Right.
I mean, the rash is different, but then the pain, right?
Right. That pain that happens later on. The initial pain, we call that acute. Acute is the fancy word for, you know, happen right now and happen fast. The acute pain comes with a rash.
Okay.
The whole course tends to last about 3 to 5 weeks, start to finish. But then the secondary pain is something we call post-herpetic neuralgia.
Okay.
So,
post-herpetic neuralgia.
right, because the shingles virus, which is the same virus as chickenpox virus,
Right.
is in the herpes family.
It is. Okay.
Right. So it's not genital herpes.
Yeah.
But it's almost like, you know, if you have a Toyota Camry and a Toyota Corolla.
Yeah.
You know, they're both
Not the same, but the same brand.
right.
Yeah.
So the shingles virus is the same family as the genital herpes virus, which is why we say post-herpetic.
Right.
Post-herpetic, you knocked down the virus a second time, but now this neuralgia, painful nerves. And that nerve pain, which my father had, can be debilitating.
Wow.
People sometimes can't even wear a shirt because even though you might shake someone's hand or touch them, if you just the light brushing movement alone will cause unrelenting pain.
So the pain on the second phase, you'd say, is more painful than when you have the rash.
Yes.
Okay.
Now that phase, as I said, this post-herpetic neuralgia, which can go 90 days or more, that's about 10 to 15% of people.
Okay. So there is a majority that do not get pain at all.
Right, they don't get that second pain.
Yeah.
Right.
Okay.
But still, the 30 days, you know, 3 to 5 weeks of the initial pain is pretty awful too.
Right.
People can't go to work sometimes. Right. And the point of the the vaccine is to lessen your chances of getting shingles in the first place.
Right.
You don't get shingles, you don't get that post-herpetic neuralgia.
Right. Okay. Well, is there a reason or a cause for shingles, risk factors that we should know about?
Yeah. Well, of course, the biggest risk factor is having had chickenpox.
Yeah.
Right. So, you know, I guess again, just to, you know, summarize and put things in perspective again, you're a child, You don't get the chickenpox vaccine, so you wind up getting chickenpox. Your body fights off the chickenpox. That virus then goes into hiding somewhere at the base of a nerve for years and years and years. It does nothing. It just stays there quietly.
Yeah.
And then when you get older and your immune system gets a little bit weaker, that's when the virus tends to wake up and say, aha, I'm going to cause shingles.
Okay.
So your immune system does a pretty good job of keeping that virus at bay, making sure it doesn't do anything.
Okay.
And then at some point in time, the virus realizes it can get around your immune system. So the biggest risk factors, of course, must have had chickenpox first. Second risk factor would be age. Children can't get it. I treat children.
Oh, children do get shingles as well?
About 0.26%.
Oh, okay.
Small.
That is very small. So
Right.
is that due to their immune system being pretty weak then? Mm-hmm. Okay.
Well, in most cases, it's children that may be treated for leukemia
I see.
or have some other underlying condition that lowers their immune system.
Sure.
But every now and then, just who knows why, it just
Right.
happens to happen.
Right.
So age is the biggest risk factor. Women tend to get it more than men.
Oh.
And African Americans tend to get it less.
Oh.
So a risk factor would be being white.
Right.
So if you're a white woman over the age of 50 or really over the age of 60, you're really at the biggest risk.
And a weak immune system. Right. Okay, so let's talk about some of the prevention and treatments. Of course, we have the vaccine.
Right.
But let's talk about when you have the blister.
Yeah.
What do you do? I mean, there's rash meds. There's what kind of stuff do we?
Unfortunately, there's not much.
There's not?
No.
Oh, man. Oh.
So when the rash first happens, or really when the pain first happens, within about 72 hours, we can give you a medicine called acyclovir
Okay.
or Valtrex.
Valtrex.
So these medicines help fight the virus.
Okay.
The unfortunate thing is they really do the most work within 72 hours. So if in the first 72 hours you can have the, presence to say, oh, I think this could be shingles,
Right.
get the acyclovir, it will lower the severity of the disease.
Okay.
So everything will kind of happen more quickly. The rash won't be as bad. The pain won't be as bad. Your chances of this post-herpetic neuralgia will be much, much lower.
So this is obviously prescription, right?
Right.
So I guess I'm just thinking of time. Like if I'm getting pain, I don't know if it's shingles until the rash comes after a few days.
Right.
So sometimes maybe I miss that window, right?
Right. Well, typically if you get it within 72 hours of the rash
Okay,
is when
of
it's
the rash.
best. You want to give it before those blisters form.
Okay.
Certainly once you feel the pain, if you can do it then, that would be best. But the problem then becomes, someone thinks, oh gosh, what's this weird pain? Then they go away for the weekend, then the rash appears,
Right.
then 4 or 5 days go by, and at that point, there's not a heck of a lot you can do.
Okay. So if you are, as a child, did not get the vaccine and you have chickenpox, you should get the shingles vaccine.
If you, as a child, had chickenpox, yes, then as an adult, you should get the
You
vaccine.
should definitely get the vaccine, right?
If you did not have chickenpox as a child, just stay away from people who have shingles.
Okay. So what do people do when they have shingles? When it's the blistery stage, just cover it up?
Cover it up, basically,
Okay.
yes. Yeah, make sure
Don't
that
touch
those
anyone.
blisters don't get in contact with anyone.
Are there any people that should not get the shingles vaccine?
Well, mostly people who have a very much reduced immune system.
Okay.
That's pretty much it.
Okay.
Now, this happens to be the second vaccine we have for shingles. And this vaccine actually does a lot better than the last one. The last one worked about 50% of the time. The new vaccine that
Yeah.
you may have heard about called Shingles
Yes.
will stop at 97% of the time.
Wow. Okay.
So,
Much better.
yes.
Okay, good. Any home remedies? Natural remedies?
Yeah, and again, unfortunately, not much. Because as far as actually treating it, well, you got to treat the virus.
Right, right.
And we don't have much for that. But symptomatically,
Yeah.
just to treat the pain, to treat the rash, cold compresses, just
Okay.
the cold soothing will work. Also, oatmeal baths
Okay.
can sometimes help.
Good.
And in general, I would say your body's own immune system does an amazing job
Yeah.
And we sometimes don't give ourselves credit.
Right.
There was a study done back in 1918 when a worldwide flu epidemic came about. They took a hospital and they said, this whole floor of people, you got the flu, you're going to stay in bed, you're not going to move, you're sick. They took another floor. They said, you people, once a day or twice a day, get out of bed, go outside, walk around the courtyard, get back in bed. 80% of the people who walked lived. 80% of the people who didn't died.
Whoa.
Just because we were allowing our body to do its job.
Right. So immune system is a huge thing.
Oh, yes.
So then I'm guessing stress might be a factor for your immune system, dietary, anything like that? Is there anything that...
Stress can definitely be a factor.
Okay.
Stress is an interesting thing because whether you're going through a really difficult time at work, maybe difficult family life, versus someone who is, say, in a war zone with bullets flying over their head.
Right.
The response your body has in either situation to stress is the same.
Wow.
As far as the inflammation that happens, the adrenaline that goes. So stress can definitely be a big factor.
Yeah.
There was also a study done which showed people who had head trauma or injury to the head within a month of getting shingles were more likely to have the shingles appear on their head.
On their head. Wow.
It's just one study.
Yeah,
but it kind of does show how stress, yes, can play a big effect.
Yes, stress seems to be a culprit to kind of everything, not just most things. How about dietary remedies? Is there anything you should not eat if you're on shingles?
Not that I'm aware of.
Okay.
Other than just having a healthy diet.
Healthy diet,
you know?
yeah, for your immune system, because I mean it all relates.
You know, there's a great thing that I've seen in clinic is people often say, I think I have gluten intolerance, right? Separate topic.
Yes.
But we test them and they're not. And they say, I don't care. I'm going to go gluten-free anyway. And they feel better, much better. And I don't think it's so much the gluten because they were not gluten intolerant, but our diets have so much in it that grandma wouldn't cook.
Right.
And if grandma won't make it,
let's talk about
well, look at the back of anything, right? How many ingredients can you not pronounce, right?
We don't even know what it is.
Right. Yeah. The amount of processed sugar, which again is a whole separate topic.
Sure.
But from just a very broad point of view, if you only eat what grew in the ground within 50 miles or 500 miles, you know.
Okay. Good. No, let me ask you this. Now, you talked about the second vaccine that came out. If you already had that first vaccine, should you go for the second?
Yes.
Yes. Okay. And if you've never had any, should you just do the second?
Just do the second.
So either or, go get the second.
Go get the second.
Okay.
Yes. And the second one is a 2-dose series. So you get the first dose whenever, and then 2 to 6 months later, you get the second dose.
Okay. And
it does cause some, it can cause some mild just fatigue, low-grade headache, tends to last, not even flu-like symptoms, but yeah, very, very low-grade flu-like, I guess you could cause it. Won't cause breathing trouble. Flu is a breathing disease. I got the shingles vaccine, and you know, I think within 24 hours, I just wasn't feeling great.
Yeah.
Wasn't feeling sick.
Yeah, you just didn't feel yourself.
Yeah, and then I realized, oh, I had the shot yesterday, and then the next day I was fine.
Okay, good. Well, I kind of want to, when I was researching this, there was a lot of, I saw a lot of like myths and facts happening, and I wanted to kind of have like a little segment, myth or fact. So I'm going to just bring it up, and you tell me if it's a myth or a fact, and explain your answer.
Sure.
So only older people get shingles.
Well, myth. However, the vast majority of people get shingles. You know, as I said before, a very, very small number of children can get it, particularly if you are someone who has a suppressed immune system.
Sure.
So leukemia and HIV would be some in children, or other rheumatologic diseases, particularly if they're on medicines that lower their immune system.
Sure.
So myth, it is not only older people. The vast majority are older people.
Okay.
But we've been seeing even 20s and 30s and 40s much more of a
increase in patients. Okay, how about shingles is a rare disease?
Myth.
Myth.
Yeah. About 1.2 million people a year get shingles in the United States.
1.2 million. Wow.
Worldwide, depending on which report you read, anywhere from 30 to 50% of people in their lifetime will get shingles.
Wow.
If you don't get the shot. the vaccine.
Right. So should people go to their primary physician and just ask for it?
Well, you can actually just go to a pharmacy.
You can go to a pharmacy and get it done there.
Yeah.
Oh,
yeah.
just like a flu
Your
shot.
pharmacist is a doctor.
Oh, amazing.
Doctor of just drugs.
Doctor of medicine.
Doctor, yeah.
Great. Okay, so how about, well, I kind of feel like we answered this, but you can't get it more than once.
Right. Yeah, 1 to 4% of people will get it a second time, but the second time you get it, it will be a less severe outbreak than the first time.
And then stress can trigger it.
Stress can trigger it, yeah.
Okay, how about this one? It can cause vision loss.
It can cause vision loss.
It can. That's
Yes.
terrifying.
Yeah, that's
Is it depending on the location? If it's on your head?
Right, it's depending on the location. So,
That's terrifying.
when it appears over around the eye, and the biggest warning sign of this is if the rash starts appearing and you get one of those little bumps on the tip of your nose, that correlates with a much higher incident of possible vision loss.
The tip of your nose.
The tip of your nose.
So you're saying there's the rash ends up on the tip of your nose.
Well, not just the tip of the nose. It will be there and spread around
And it'll
other
just be
parts of your
around.
face. So something else that I didn't mention before with what does it look like?
Yeah.
Because the rash goes into hiding in the nerve base just outside the spinal cord, it will, the vast majority of the time, only be one side of the body.
Oh.
So if you ever Google the rash, you will see lots of pictures of people who have it on their face, and it's very clear. It just goes right down the middle and stops there, and will stop around the top half of the face if it's going to involve the
Sure.
eye. And so it has to do with, again, what nerve the virus decides to settle down in after chickenpox.
Okay.
And if that happens to have been one of the cranial nerves, the nerves that come from the brain and then go out, a nerve called the trigeminal nerve, then it will possibly affect your vision.
So then the nerves in our, like going into our face are only one-sided? They don't kind of touch the whole face?
Well, it's not that the nerves don't touch the whole face. It's that the virus picks one. You
Just
have
one.
two nerves.
Oh, okay. I see what
Two
you're saying.
nerves around the back, two nerves around the face, and the virus is just picking one of them, and that's where it presents.
Okay, very good to know. A lot of information. How about, well, here's the next one. It can hurt or affect your brain.
It can,
It can.
yes.
Like, how does it affect the brain?
Well, again, another rare presentation of shingles, and most commonly in people who are immunosuppressed. But usually when we talk about shingles, we talk about the virus getting in the nerve that goes from the spinal cord away from the spinal cord.
Okay, so
starts
there, but it
there,
goes away from
goes
it.
away from it, down the arm, down the chest or
Yeah.
lumbar. But sometimes it can start there and go the other way.
Right, right.
And it's when it goes the other way that it can work its way up into the brain. And even chickenpox can be life-threatening.
Wow. So my question is this. When you talk about the pain that's associated with shingles, the chronic pain that I read a lot about, is this chronic pain throughout your whole body or just in that location for those weeks that you were saying? And what do people do about that kind of pain?
Right. That pain is in that location. Again,
Okay.
it does.
Only in that...
Stays in that location where the rash was.
Sure.
And what do you do about the pain is a really tough one.
Oh, man.
If you, depending on which sites you read, the National Institutes of Aging do recommend medications like gabapentin or Neurontin, something called tricyclic antidepressant.
Antidepressant.
Yeah, it's a form of antidepressant that can help with pain.
Oh, okay.
Pain just in general is very, very difficult to treat.
Right.
As you may know, there's an opioid crisis that we've been
Right.
trying to address.
Right.
Well, something like shingles, the official recommendations for the National Institutes of Health don't recommend opioids.
Okay.
But this is a kind of pain where, akin to cancer, sometimes opioids are needed.
Right.
We obviously try to avoid them as much as possible, but they do work better than just about anything else.
Yeah. I mean, it's pain. Pain is pain, right?
Right.
Yeah.
Right.
Yeah.
But in some forms of pain, in many forms of pain, opioids don't help.
Right.
Shingles is a finite period of time. So that's why we say that the opioids may be okay. We're not expecting someone to need the opioids for years and years and years, because the shingles tends not to do that.
Right, right. So that's all the time that we have for today. Is there anything else you would like to add?
Sure. I guess just to reiterate that the shingles vaccine definitely helps. Shingles can be awful. It can be painful. And we have a very good way now to prevent it. And we just went through a whole series of myths versus truths. You can look on the internet and you can find information on pretty much anything you want. The reality is that you're better off getting the vaccine than not. Can you search and search and search and hear someone tell you that a single child did get shingles after getting the chickenpox vaccine? One person that we know of.
Okay.
But does that mean that you shouldn't get the shingles vaccine? No. I guess my point is, trust your doctor. You know, we're here to help you. That's our whole purpose in life. So if you find information on the internet, come and check with us if it sounds a little bit suspicious.
Sure.
Yeah.
Thank you. This is very, very informative. Thank you so much, Dr. Brown, for joining us. It's been a pleasure.
My pleasure.
And for more information or to make an appointment, call 866-320-4573 or visit www.clevelandclinic.org/Medicine Institute. And thanks again for our listeners and viewers for joining us today. And to listen to more of our Health Essentials podcasts from our Cleveland Clinic experts, make sure you go to clevelandclinic.org/HE podcast, or you can subscribe on iTunes. And for more health tips and information, don't forget to follow us on Facebook, Twitter, Snapchat, and Instagram at Cleveland Clinic, one word. Thank you so much for listening.